I'm Sachin Patel, founder and director of Aged Care GP. This video is for family members of residents in aged care, and you're seeing it because you want to know what to expect if a family member contracts COVID-19. So I just want to start this conversation by just explaining that this may contain some difficult information for you, and I'm sorry if it causes distress, but I think it's really important that we have this conversation so that in the unfortunate event that coronavirus, COVID-19 occurs in a family member in aged care, that you're fully understanding what to expect. It's not intended to cause alarm. It's about preparation over panic. You would be, I think, better off knowing this information than not. So here goes. So I said in the first video here that 80% of people with coronavirus, COVID-19, they get better themselves. Well, 20% it's severe, and that 20% require significant help by means of oxygen and or ventilation. And that means in things like intensive care units in hospital and hospital wards. Now, what we found from data in China and in Italy is showing us that there's a clear pattern that older people and people with chronic disease and chronic health problems, they fare far worse with this illness. Unfortunately, the complications and death rates are significantly higher. Now, in the event of an outbreak, as is predicted, unfortunately, there will have to be some difficult choices made about who can receive treatment and who's likely to benefit from treatment. And what we know is the subgroup that are in aged care, who are generally over 70 with multiple other health problems, unfortunately they would not be candidates for significant treatment in hospital, because the evidence is showing us that those treatments will unlikely help them and cause unnecessary distress and discomfort, and could stop other people who may benefit from treatment accessing it. So there may be some difficult conversations and difficult moments if a family member does get COVID-19 or coronavirus, and we think it's important that you know the facts as they stand at the moment, and are also prepared that if a family member contracts COVID-19, we'll do all that can be done within an aged care facility would be done, but it's unlikely that external treatment would happen if coronavirus or COVID-19 happens on the scale that is expected. And I know it's a difficult conversation and a difficult thought to process, so I do apologise for that, but I think it's important that you've been informed about this and you understand it. So I think the way we should proceed if you've got a relative in aged care is that if there is an outbreak to the level that's expected and widespread community infection, then we should assume that hospital won't be an option. And so all the things we do now should be about preparing for that. And what that means is making sure things like medications that are appropriate to keep people comfortable if they do deteriorate, and help make sure that they're able to maintain comfort and peace and dignity towards the end of life. I think those things are really important to have in place, not because we're expecting it, but we can prepare for those things. And whilst we can't necessarily change the course of what happens to a family member, what we can do is do our very best to make sure that whatever does happen, we've given the very best care in terms of keeping them comfortable and at peace and with dignity, if that's to happen. So look, I've been Dr. Sachin Patel. I appreciate this is a difficult conversation. Your doctor will have other information should you want. But what we've done is we're trying to create this information for you so that you can just be prepared, and by all means go and do your own research and reading to help you understand. We'll do our very best by taking some measures to and encouraging facilities to take measures to try and prevent this entering facilities. But the likelihood is at some point it will enter some facilities, and our job is just to try, between us, yourselves, family, between the facilities, to do our best to minimize those risks. I've been Sachin Patel. Take care. Bye-bye.